My name's Kevin Eichenauer. I've been here at the hospital for the last 12 years. I'm one of the social workers here in our department. I help coordinate the education program with the students here through the College of Social Work. And I also am one of the social workers mostly on general surgery. Well, I've been involved in healthcare ever since I graduated 30 years ago with my social work degree. I worked primarily in nursing homes up until about 12 years ago when I came to the hospital. I was led to come here because I like working in the hospital. I wanted the opportunity to work in a teaching hospital. I like the opportunity to work as part of a larger healthcare team with a lot of different professional people to be in with the different disciplines and so on. Well, in the social work department, we're primarily a consult service, and we work through consults from the different disciplines. We provide different services such as counseling for drug and alcohol. Maybe traumatic injuries need counseling for the patients. It might be for terminal illnesses that we're dealing with. We also work a lot with discharge planning on helping patients to discharge from the hospital, plan their needs they might need, what level of cares they're going to need, and so on. Well, there's a variety of things that we do. We are a larger hospital. There's many different social workers that work in different areas. One of our primary responsibilities is doing comprehensive psychosocial assessments on, for the patients for the different disciplines. It might be for transplants. It would be for maybe domestic violences. It might be for abuse issues and things like that. We also try to help the patients and their families understand the reasons that they're in the hospital, adjusting to role changes. We work on educating the patients with what the healthcare team is involved in and the different disciplines in the healthcare team. We also try to work with the patients on educating them for the reason they're in the hospital, their illnesses, the treatment for the illnesses, consequences of treatments, consequences of refusing treatments too. We also help to educate the patients on what the staff is, who the staff are, what the doctor's responsibilities are, therapeutic responsibilities, things like that. We also try to educate the doctors as well as the patients in regards to psychosocial needs that the patients might have, in regards to discharge planning, in regards to things that might be going on while they're in the hospital too. We try to educate the patients in regards to the different level of cares that they're going to be going through. The acute care in the hospital, the subacute care if they go into a nursing facility, or even if they go home with home health care. And some of them may return to the independent living setting that they might have been in before too. We coordinate the patient's discharge plans, whether it might be going to the nursing home or whether it might be going to a long-term acute care hospital. We also work with dialysis centers, discharge plans for dialysis. We promote communication between the doctors and the patients, and between the healthcare team itself too. So we try to make sure that everybody's all on the same page with everything too. We also have social workers that are part of the transplant team, burns. They do psychosocial assessments for those too. They also have the OB social workers that are responsible for newborn mothers, drug-addicted mothers, prison mothers. They work with patients and families and babies in the NICU, and all the different issues that might go on with that too. We do a lot of community resources as well. We try to help patients to find funding sources for things they might need, whether it's durable medical equipment, whether it's prescriptions, different things like that. We try to get them whatever they don't have that might have put them in the hospital and they can't continue the care at home. We try to help hook them up with all those different services too. We also try to do support groups for certain different departments. We also have the James Hospital here with the cancer patients, so some of those different social workers in the James might be involved in different support groups for the different cancer illnesses that they might have. We also have, over in the Ross, we have the Heart Hospital, so we might have heart transplants and things like that over there, or heart surgeries, open heart surgery, and the social workers over there might have support groups to go along with that too, to help patients in those issues too. Well, I enjoy working in a teaching hospital. I enjoy being part of a large team. I enjoy that my input is important, that what I know about the patients and what I find out about is just as important to the physicians at other different services too. I enjoy working with patients. Some of our patients are here for a long time. Some are only here for a few days. I enjoy seeing the patients respond to their health care here in the hospital, and I enjoy seeing them go home. Whether it's returning home or whether it's going to a nursing home, I just like to see them going on to the next level of care that they need. Well, they need to be compassionate. They need to have good communication skills and empathy. They get involved in crisis intervention and some counseling. They need to be able to work as part of a healthcare team and part of a team. Like I said, their input's very important, but they have to be able to communicate with the rest of the team as well. They need to be able to problem solve and be able to make decisions. The hospital can be very fast-paced at times, so you may have to juggle your schedule. And you may be needing to do something now, but have to do something else 5 minutes from now that's more important. So decision-making is very important too.